struggle with different forms of pain, whether it's migraines or maybe some chronic back pain. And the thing is that as many resources as we have out there, there may not always be one easy solution. It certainly may not just be one pill or one visit to a chiropractor. So I personally know a few people afflicted with chronic back pain. It seems like nothing can give us the answers. Well, I'm here with Dr. Alexander at South Texas Brain and Spine Center, and we're here to talk about that. So if this is resonating with you, pay close attention. First, let's discuss what are some common leads into just chronic back pain if nothing significant has happened to us.
So back pain is actually very common. It's almost like the third most common cause of going to the emergency room. And it could be from small injuries, just bending over incorrectly, or sleeping wrong, or working and you have severe pain afterwards. So the different ways we can treat it. We try to keep surgery as your last options.
Okay, and so say we've exhausted all those efforts, right? And a lot of these, the pain is so significant that it does take something pretty adequate to get rid of that pain and make us comfortable again. So if we've exhausted all our options there, what are some other procedures we might want to consider, and what should incline us to come and visit you all to look for the solution?
So typically we recommend seeing your primary care doctor first, and they'll examine you. If they feel that they have to do more imaging, they will usually order an MRI scan, usually the standard of choice, that tells you how the nerves, anything that's causing pressure on, that cause an origin of the pain. The key is to find out what's causing the pain. Sometimes you can't find a source of pain. Then there's, we try therapy, you can try acupuncture, you can try pain management with injections. Try those modalities first, and then at that point consider surgical intervention if possible. Then that's when you would see a surgeon.
Okay, so surgical intervention, here we are. And we've got some really interesting technology in front of us that I think I've never heard of it. I didn't know it existed, but it seems like a reasonable solution. So tell us a little bit about this technology.
So these are mainly used for patients who have failed back surgery or don't have a major organic problem with their back. So there's nothing that we can go in there and fix. Or someone who is really elderly who can't really tolerate a big surgery, this may be another option for them. So this is called a dorsal column stimulator. And basically the theory is that you put a small paddle lead or electrode over the spinal cord, it sends a signal through a generator, and it blocks the pain. And so this is a pain pump. So, and this is a pump that you implant in the body, usually in the belly, and this catheter goes under the skin into the spinal canal, and it infuses a pain medication, usually morphine or Dilaudid or some other medication. Sometimes for patients who have stiff man syndrome or spasticity, they would put this pump in that delivers baclofen. So the goal with this one is to try and get off narcotics.
Yes.
You're bypassing the liver, and you're actually injecting the pain medication into the pain receptors on the spinal cord. So you're actually treating the pain at very low doses. Pain management doctor will do a trial injection, and they monitor you and see how you do with your pain. You want at least 50% reduction of your pain to be a good candidate for either modalities.
So this is something you can test out, and if you're not a fan, then you move on and find something else to help.
Yeah.
Wow, very interesting. Well, I really enjoy these visits. It's so cool to understand what type of technology is out there, even if it's something you're not currently dealing with. I feel like every topic we cover, there's somebody that I know personally that I love that's like, oh yes, so-and-so has this, so-and-so has that. And it's great to know that we have these options. So the more you know. And with that said, our friends here at South Texas Brain and Spine Center are ready and willing to help you find a resolution to those pains, whatever issues you may have. So contact them and let them know that Coastal Living sent you. Thank you so much, Dr.
Thank you. Thank you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.